I remember when I first practiced meditation, I was 18 years old, and I remember feeling like I'd come home. The reason we do these practices is to be joyful, to be happy, to be present, so that if I'm walking with my children and I have their hands in my hands, I can feel their hands in my hands. I'm aware of it, and I'm not worried about the telephone bill or the problems that I have, that I can simply be present. We all know the story of Medusa. All these warriors went out to slay Medusa and they were unsuccessful. If we look in trauma's eye, we turn to stone, we freeze. And we understand this about the nervous system also. But if we can look at the mind's reflection, which is the sensations in the body, well, some of these thoughts and images that we have that are overwhelming, that freeze us, when we bring our awareness to the body, there's more movement, there's more adaptivity. And we can start to become friendly with the trauma, with the experience, and we can start to transform it in a sort of roundabout way.
Welcome to the Living a Life in Balance podcast. My name is Abdullah Boulad. I'm the founder and CEO of the Balance Rehab Clinic. My guest today is David Cornwell, a psychotherapist, meditation master, and somatic experiencing practitioner at the Balance. In this episode, we discuss the power of combining psychotherapy with mindfulness practices such as meditation and somatic work, treating trauma, eating disorders, addiction, and other health conditions. We dove into what it means to be a man today and how we all have an inner wisdom that we can access. David guided me through an introductory meditation practice that I also invite you to join. I hope you will enjoy. David, what motivated you to do what you do today?
Well, what I'm doing today, I work as a therapist at the Balance, and my main background is with sort of mindfulness-based psychotherapy or embodied psychotherapy, and the motivation for that really began when I was 18 years old. I would say it began with growing up in Ireland, in a large family, and then moving to England, going to university in England. And in my first days of university, someone gave me a book on meditation, and I was so taken with the book. I read it cover to cover overnight. And the next day I found myself in a meditation center I was living in Newcastle upon Tyne. And I found myself in the local Zen center. And I started practicing in quite a disciplined way for the next 3 years that I was at university. And when I left university, I thought, okay, I'm not going to pursue the career path that I had studied. I knew that I wanted to continue with meditation practice, and this had become my life. It was very clear to me. And that took me on journeys to different retreat centers. I was living in Ibiza at one point. I was living in this amazing meditation retreat center in Ibiza. I was in my early 20s. And then I moved to Istanbul. I met someone who would become my wife and the mother of my 2 children. And she was Turkish, and we moved to Istanbul. And together we created a sort of mindfulness and yoga centers, these amazing studios that were a huge success. But I found myself at the time moving out of the practices that I loved, the mindfulness practices, doing some yoga practice, but mainly meditation, and moving into a more management role, which just wasn't me. Although it was good, the place was exploding, it was really successful. It was an amazing thing to do. I was in my mid-20s, and I found myself in having these amazing centers, and we straddled Europe and Asia. There was a studio in Europe, there was a studio on either side of the Bosphorus. But yeah, I found myself really in this management space and not doing so well, not being very happy with that. And it was at that time that someone had told me about a trauma therapy training that was happening in Ireland, very close to where I grew up. So, and the trauma therapy, what I love about trauma therapy, it's really about the relationship between the mind and the body. And that's what mindfulness is about. It's really about the relationship between the mind and the body. And I felt that this was a natural sort of progression of my personal practice. And it was much more suited or tailored towards the Western psyche. So in terms of the Eastern psyche, where you maybe sit alone on a cushion and you meditate for hours a day, I think we're much more relational beings, and we need that extra layer of work, that maybe through therapy, and life is also so difficult and so complex. And I started to realize the importance of this type of work. So I was living in Istanbul, managing this huge business actually at the time for a yoga studio and meditation center. And I decided to leave that and to train as a therapist in order to continue my own development. So I trained in Ireland, which was amazing for me because I kind of ran away from Ireland when I was 18. I was happy to, like many of us, we all have our own stories from our childhood. And I felt that especially my teenage years were more chaotic, more difficult. So it was really wonderful for me to go back to Ireland and to do this training there. I found it very transformative. And then when I was doing this training, I realized that, well, I wanted to develop my skills and get more licensing. So I studied, there was a college in England, in the south of England, that was based, it was a mindfulness, it was a training center to become a licensed psychotherapist. And that training center was based upon Buddhist psychology. And it's similar in America, you have the Naropa Institute, and in the UK, you have the Karuna Institute. These are kind of sister colleges. Some people will be more familiar with the Naropa Institute. So I did the training there, as well as getting a master's in mindfulness-based psychotherapy and a licensed psychotherapist. And then one of the participants on the training that I was at was a guy called Chris Cullen, Chris Cullen teaches mindfulness every week in the Houses of Parliament in the UK. And he's involved in the mindfulness into schools, but he has quite an active role in the development of mindfulness in the UK. He's a wonderful speaker. And he's also very involved in the Extinction Rebellion at the moment. But he was on the training I was at in the UK when I was training to be a therapist. And he encouraged me then to apply to Oxford. He was also teaching Buddhist psychology at Oxford University. And he said, look, come and do the master's program at Oxford, and you can, it'll really tie a lot of these pieces together. So that was really cool. So I went to Oxford. I studied the neuroscience of mindfulness, Buddhist psychology, cognitive science, and the clinical application of mindfulness. And I felt like all of these things, it created for me, there was a deep understanding was developing around mindfulness. Like today, I also have a 25-year disciplined practice of meditation. So I threw those pieces in, and I felt that I had something to offer as a clinician, that I could really help people to understand the relationship between the body and the mind, how the mind is this, or how the body is this amazing resource that we have that can help to transform our difficulty, that we need to sort of listen to it and trust it, and to really support people to cultivate that connection to the body. You know, the word for mindfulness, the original translation is the word sati, which means to remember. It's simply that, to remember. And I think we've forgotten that we have this amazing wisdom in our bodies that can help us to deal with life's difficulties. You know, we have this amazing mind which can help us to figure things out, that we can really solve the most complex things. But when it comes to an emotional problem or something that doesn't have necessarily a real world solution, an easy solution that we can fix, then it's so valuable to drop into the body and to work with the wisdom of the body that can help process what's difficult in our lives without necessarily having to fix it. So I think it's that journey that brought me here.
Beautiful.
And to my work as a therapist, to support people to remember that they have this amazing resource that's there. And if they can just drop into it and reconnect to it, then it will support them in their lives.
Thank you very much for sharing that. So what you are doing, or what you did, is basically went through the meditation, then into the body and the mental psychotherapeutic side. But what interests me is, at the age of 18, not many people would be ready to jump into an meditation.
Yeah.
So what was at that time for you special, or what draw you into this education?
Yeah, there's so many pieces to it, I think, Abdullah. So I grew up in the north of Ireland, in a village, in a small fishing village outside of Belfast. And I had a wonderful childhood in many ways. I had 6 brothers and sisters. My father was a fisherman. And there was a very strong sense of belonging that I had growing up in this community. There's a really sense of belonging, and there is a sense of connection, and I knew everyone. I had many friends, huge family. But I think there's also a piece where the people are not doing therapy. People are not working on their shadows or working with what's difficult. And when I was 18 years old, I just felt that I was a little bit lost. I had, growing up in this, in a very tight community with very clear expectations of what it is to be a man, what it is to be from here. All of these factors, I felt that I was kind of aware that at 18 years old, I was not in a good space. I was a bit lost. And it was coincidence that brought this book to me, this book on meditation. And a story that I often tell is that, so this, on my first day at university, almost, or the first week at university, I made friends with this guy. His name was Ross, and he was him and I were best friends all through university. And it was him in the first week that brought me this book on meditation. When I read it, I realized that I needed what was in there. I needed this transformation, this inner transformation. But the reason I tell this story is because Ross, who was my best friend through university, we both graduated the same time. And shortly after the graduation, he died of a heroin overdose.
Oh, wow.
And so I found it interesting. So he's one of the few people I know in my life who is a avid reader. He would read book after book after book. And what was interesting, what I reflect on is that I got this book. We both came from a similar background, working class background, lots of chaos, lots of stuff, lots of alcohol, drugs that were around. But when I got this book on meditation, I did the practices. It impacted me enough to go to a Zen center and learn meditation. He got the book on meditation and never practiced. And shortly after university, he died. And I would say these are sliding door moments in my life, that his life went in one direction and my life went in quite another. And I have a lot of gratitude for him at that moment giving me the book, but I can sort of reflect on it and see how mindfulness and these practices supported me to have a completely different trajectory in my life.
I'm sorry to hear about Ross, and I hear you now how this has affected you. So when you talk about meditation, what did it give to you at that time of your life, and what happened in your body? Were you better connected? What was it that intrigued you to go deeper into this practice?
Okay, well, when I learned, there were two practices which I learned. One was the mindfulness of breathing, and that's a practice which I still do several times a week. And the other practice was a self-compassion practice. These are the two main practices, let's say, that are taught in the mindfulness tradition. They're often described as the two wings of the bird. One wing is about cultivating insight, clarity, and compassion and wisdom, and the other wing is about cultivating self-compassion. So I think I remember when I first practiced meditation, I was 18 years old. The Zen Center was running a 6-week meditation training. And I remember feeling like I'd come home, like sitting in that meditation posture, really comfortable, cushions around me, beautiful space. I remember the beauty of the space. It was just it was very calm. And I remember the teachers that were there seemed very regulated. They had a quality of presence which I hadn't really known before. And they also, the teachers were men, and I also recognized they had a maturity, sort of emotional maturity. They were able to communicate, they were able to talk. And I remember just immediately feeling the gift of that. Like it was a very regulating environment to be in. So the practices, I think what they did first was cultivate a lot of self-compassion. So I would alternate. One day I would do the mindfulness of breathing meditation. The next day I would do a compassion practice. And I alternated these every day for 3 years. And what I experienced was a lot of self-compassion, a lot of loving myself, for want of a better word, taking care of myself. And then the other piece was that I started to see myself with more clarity, to understand the patterns that had become established in my life and how those were sort of unconsciously sort of running. They were like, sort of these deep ocean currents that had become established and were driving my behavior unconsciously. And through mindfulness practice, I started to work with these patterns. And I didn't work on them directly necessarily. It's just the process that happens when you start to have a disciplined meditation practice. These things start to transform by themselves. I also understand the regulating effect on the nervous system. It starts to transform the nervous system. These are things which I try to support the clients at the balance with, for example, is the understanding, and this is all evidence-based, is that you see in quite a short amount of time how structures in the brain begin to change. For example, the amygdala you see research done on 8 weeks of meditation practice that an enlarged amygdala starts to, because of neuroplasticity, it starts to change its state and its function. There's less gray matter density. And I think that these things happen. This is just the byproduct of doing a meditation practice. It happens for everyone. If you do a practice, you get these structural changes to the brain affecting, our emotions, our cognition, our nervous system regulation. So I would say that there was a lot that was happening in those early days of me practicing that I wasn't aware of, but my sense of myself was changing. It was unfolding, and I felt much more in myself. I was, and I think actually ultimately I was becoming happier, and that's the piece that's key. And this is something I say to people all the time: is that the reason we do these practices is to be joyful, to be happy, to be present, so that if I'm walking with my children and I have their hands in my hands, I can feel their hands in my hands. I'm aware of it, and I'm not worried about the telephone bill or the problems that I have, that I can simply be present.
Yes.
And this is what I was beginning to cultivate back then as an 18-year-old. And just moving from a space of more chaos or more disorganized and dysregulated nervous system into a more organized, present, and regulated system. And that was the gift. And a lot of that was happening unconsciously. In fact, I think most of it was,
No, it's certainly a beautiful technique, and more people are applying meditation around the world, and it's been more recognized today. There are multiple types of meditation. There is certainly the breathwork-based meditation, and more others. Can you explain like the differences and which is your favorite one?
Yeah, you're right. There are so many different practices. But I think what they have in common is the intention to transform people's suffering. This is what's at the heart of them. So I think it's very easy to get caught up in, there's this practice that has this copyrighted information, and there's this one that, is this and this and this. For me, what I feel is that the simplest practice is just sitting still and watching the breath. So I think that, and this is a practice that is at least 2,500 years old. And if we look, for example, at the story of the Buddha, it was, and we talk about his awakening, it was doing breath meditation. If you read the accounts of his awakening, let's say, it is about sitting and watching the breath and supporting the regulation of a sense of deep regulation and calm that he was able to cultivate, so that he could then see things with greater clarity. But it was always taught with the intention of reducing suffering. That was the MO, was that we would recognize that life is filled with pain. There's an inevitable amount of pain which each of us comes into contact with in our lives. Some people are more lucky than others. But there's this extra layer which is about reactivity, how someone is reacting to the reality of their life. And that's where these mindfulness practices are focused. They're focused at working with the reactivity and to transform that reactivity. So if you have a breath meditation, that can be working with that reactivity. If you have a compassion practice, that can be working with the reactivity. Similarly, if you're in a Zen practice staring at a wall, or at another practice looking at a disc, or you're doing a yoga practice where there's movement, or Tai Chi or Qigong, all of these practices are part of the same family. They may have slight variations and differences, and one practice may be more appropriate for a certain person at a certain time.
Yeah.
But we see that they're all part of a family of practices. And I think the key is not to see what's different about them, but what is similar in them, what they're trying to impact and transform. And for me, that's all about reactivity. And this is something we see as therapists. This is what I'm helping my clients with in therapy, is to transform their experience, their reactivity towards their lives.
Yeah.
That's where mindfulness, that's the gift of mindfulness.
That's beautiful, and I think it's important to say that meditation is not just always sitting still and not do anything. It could be also involving the body, moving the body, like qigong, yoga, or other similar types of meditation practices. Sure. And my understanding is also that meditation practices are here to lower the mind's activity and connect you with the present moment, and being mindful about your surrounding, using your senses, different types of senses. This is also something I've come across in the last years. There is this term mindfulness-based psychotherapy, mindfulness-based therapy, and I know you implement this also to your daily practice. How and in what cases do you feel it's appropriate to be worked with your clients?
Well, just to answer the first part, which is, these practices, they are the coming into the body, like the mind dropping into the body. I think there's real truth in that, in the sense that when we look at the brain and how the brain is functioning, you can see this in fMRI imaging techniques. Especially, there's a neuroscientist called Norman Farb, and when we see his work, we see that mindfulness practice, when someone's paying attention to the breath, for example, it starts to utilize older structures in the brain. It's sort of a midline cortical axis. It's across this midline section of the brain. And these parts of the brain do not facilitate abstraction or imagination or worry or anxiety. But when we move into the more prefrontal regions of the brain, you see that this is when someone starts to worry, starts to think about stuff, starts to ruminate, and we start to see, depression or anxiety disorders. So when we're practicing something as simple as paying attention to the breath, we see how the metabolic activity shifts in the brain into older structures, and you can only do one at a time. The more that you're in that sensing brain, the less you're in the overthinking, the worried brain. And this is how mindfulness can be really effective. And that's something that we can cultivate, is someone's capacity to be with their sensory experience.
So I understand that mindfulness and meditation, breathwork can help everyone in our daily life, stressful life, but particularly for mindfulness-based stress reduction or psychotherapy, how do you implement this into your more clinical practice?
I think it's really helpful to understand the origins of mindfulness-based stress reduction and mindfulness-based cognitive therapy to understand how it works. So let me tell you a story.
Please.
So Jon Kabat-Zinn is the guy who was created mindfulness-based stress reduction, and he was working in a pain management clinic at, if I'm correct, at the University Hospital of Massachusetts. And he was helping people with chronic pain. Now, Jon Kabat-Zinn was also a dedicated meditation practitioner. He had studied Zen, and he had he was on a retreat. He was on a Zen retreat, which is very intense. And in the middle of his meditation, he had this eureka moment. And he had two moments. The first one was he had this insight of how he could work with people at the pain management clinic. And he had this vision of people having this vocation, this career in mindfulness, bringing mindfulness into the world to help people with their pain and their suffering. And he sort of seen this new wave of mindfulness that was going to come. And yeah, that was in 1979. So the insight that Jon Kabat-Zinn had was to help. It was based upon his own meditation practice, and it was the understanding that instead of trying to get rid of people's pain, because that's what a pain management clinic was effectively doing, they were using surgery, physiotherapy, or medication to try and ameliorate people's pain. That was the MO. He said, what if I taught people how to become friendly with their pain, which is really at the heart of mindfulness practice? So he went back to the hospital and he said to his colleagues, send me all your most difficult patients. And of course, they were super happy to do that. So he found that his studio or his clinic was filling up with these sort of hopeless cases. And he started to teach them mindfulness. And he started to teach them how they could transform their relationship with pain, which is a 2,500-year-old meditation tradition. But he was applying it in this very clinical way. Now, what was remarkable? Well, first of all, what was remarkable was it worked. They started to see these amazing results. But the other thing that was remarkable was how people's lives changed. All of a sudden, they had these new skills which they could apply the wisdom of these skills to other parts of their life, to their relationships, to their relationship with food, to their relationship with their family, to their relationship with their bodies. All of these skills started, or all of this wisdom that they were getting from learning mindfulness was transforming every aspect of their life. So my understanding of mindfulness is a very simple understanding. As I've said earlier, it's about working with our reactivity to allow things to be as they are. And so this is at the heart of the MBSR, mindfulness-based stress reduction, and mindfulness-based cognitive therapy. I think there's something else that's worth mentioning is that once Jon Kabat-Zinn started to develop this program, he systematized it into an 8-week program. And because it was systematized, it could be researched. And once they could research it, they could start to have these sort of standard studies, the standardized practice that could be studied, and they could see, well, this is what 8 weeks of mindfulness does to the brain. This is what it does to our relation to the mind. It does to the amygdala. This is what it does to the prefrontal cortex. So they had this platform from which they could develop this evidence base, which meant that mindfulness has grown exponentially since 1979, and there's a huge evidence base to support it, and people understand its utility within therapy and just for basic, people's lives. So what I do in the MBSR, I sometimes do MBS or MBCT groups. I'm a trained mindfulness-based cognitive therapy practitioner. So I sometimes lead groups, but I tend more to bring those skills into my therapy work, which is really about getting people to become more accepting of their life as it is. Like that's the platform from which I want to do the work. Maybe you're familiar with the prayer, the Alcoholics Anonymous prayer, which is, grant me the serenity to accept the things I cannot change, courage to change the things I can, and wisdom to know the difference. Well, I think that what mindfulness helps us to do and helps me to do in the balance is to get that platform of acceptance, that we can allow and accept our life as it is, because that's our reality. There's no other way. But once we have that acceptance, we can also start to change the things. We can start to, create new behaviors, new patterns. We can begin to transform our life, which is really important. But we work on these in these two ways. And I think that's what mindfulness-based cognitive therapy does. That's what I do as a therapist, is to support that. Does that make sense?
Oh, absolutely. And I've experienced mindfulness in my own life also at some point, and it helped me to calm down my mind and also reduce some thoughts and anxiety and future rumination, certainly. What conditions do you come mostly across in your clinical practice with your clients where mindfulness-based cognitive behavioral therapy helps?
Yeah. Okay. Well, with my clients, I think that what we see as therapists generally is that a lot of our wounding begins in our early developmental period in our childhood. This is, I think that's what I see. At least, even if we don't use the word wounding, we can use the word patterns. Our patterns start to establish arguably within the womb. One of my teachers would say, we marinate in our mother's emotions for 9 months. And that sense of it being a marinade, and we're getting conditioned by those emotions even within the womb. And so these patterns are developing all through our early developmental, all through our high school years, through our adolescence, teenage years, disappointments in relationship, disappointments at work. Some of us experience trauma, capital T trauma. I think that there's capital T trauma, which are sort of sudden high impact events, which unexpectedly, they reshape the trajectory of someone's life. But in terms of the nervous system, there's also the small T traumas, which is just that continuous, constant exposure to stress that many of us experience. And that also has a profound impact on our nervous system and on our lives. So when it comes to my clients, when I'm meeting you, Abdullah, that's what I'm thinking. I'm thinking, what are the patterns that have been shaped in this person's early period of their life and throughout their life that have become deeply established, and that maybe at one point they were adaptive and were helping the client, but are no longer serving the client.
Or other life experiences add up, or traumatic experiences from a small T perspective.
Yeah.
And then at some point, this is not enough. They cannot hold it anymore. Then it shows in some disorders, illnesses.
Yeah, I think you could argue that every disorder and illness, has those in their roots. And then mindfulness, it just helps people to become aware of what's happening. To really, mindfulness-based psychotherapy is all about cultivating the capacity to pay attention, to become more aware of what is moving a person through life, and to begin to relinquish some of the patterns that we are deeply invested in. We might be deeply, it's like having a bank account that we fill with money because we're deeply invested in this very dysfunctional behavior that is there. And now we have to really take the energy out of it. We've got to ameliorate these habits and these patterns.
Yes. No, I think certainly we are grabbing here thousands of years old wisdom, and we make it into a modern type of solution for today's problems.
Yes.
When I think, you've been in Istanbul, in Turkey, you have experienced like the Arabic or the Islamic environment where the the prayer 5 times a day. This is also kind of a mindful practice and meditation practice, where I find it beautiful to break up the day, not be in an autopilot mode. And the same thing with churches in the Western world, like the ringing, when the bells ring, it's like a little bit of a wake up call. There is something like now. And that's what I love, and I learned over the years to appreciate them and not just to be annoyed by the loud noises.
Yeah, for sure. And I think this comes back to this definition of mindfulness. What is the definition? To remember.
Yes.
But to remember that we are this human body. We need to sometimes take a pause. Come out of our overthinking, our worry. And just stop things for a moment and breathe and pay attention and be present. And that's what the namas 5 times a day has a similar effect.
Yeah. What do you mean with remember? Is it more based to remember what's in your DNA, in your body, or what your own history tells you? Or where do you want to connect to?
Well, remember, I think deliberate, these are spectrum words. So they're like a placeholder for many different things. The word sati can be interpreted, the word remember, in so many ways. For me, it's just about remembering to take a breath, to come to my center, to allow things to maybe feel that there's very strong emotions present. I'm having some difficult thoughts. I can zoom out a little bit and notice my mind is, the mind is filled with thoughts that are often competing against each other. The understanding that just because I think something doesn't mean it's true. That's a valuable thing to remember. To remember that I have feet on the ground, to remember that I'm holding my child's hand, to remember that I'm eating this food and I'm not just in autopilot eating it. Yes. So I think that's really valuable. And this is something that I work with, for example, with eating disorder clients, because when they see food, their awareness goes up and out. They think of food as the enemy. They just go into a very overthinking, ruminative experience of food. But they can remember to just taste the food, to have a sensory experience of food, to just taste the flavors, the smells.
By connecting to the body, they remember and they access more emotions and feelings.
But just connecting to the sensory experience. And whenever we're leading the mindful eating exercise, sometimes I ask the client, to an eating disorder client, put a bit of food on your hand, a grape, and look at it as if you've no idea what this is, as if you've been an alien who has dropped on planet Earth, and you're just looking at this grape and just appreciating its shape, its color, its textures, the way, is it moist? Is it dry? Does it have lines on it? Is it heavy? And not to think about it, not to overthink, just be in that direct sensory relationship. And as I was saying earlier, when we look at the neuroscience of this, you cannot do both simultaneously. You cannot be in that sensory experience of the grape, just from a pure sensory experience, and be thinking that what is going to happen to me if I eat this grape? Yeah. And that's something we can cultivate. Neuroplasticity shows us that we can cultivate these. It's not just magic. It's changes to the structure and to the function of the nervous system that if we apply a continuous and constant pressure, it will start to transform. And, mindfulness, if you read the accounts, the historical accounts of mindfulness, there's always this reference to artisans or to gardeners, because a skill can be developed over time, and something can be cultivated. And as well as something being cultivated, other things can atrophy. Yeah. So if a client has this obsessive relationship, overthinking with food, But if we support the client in a deliberate and continuous way to shift how they experience the processing style through which they relate to something as simple as a grip, it starts to create these deep shifts in their brain, in their nervous system, in their how they think, in their patterns of mind, and in their emotions, in their behaviors. All of these become affected.
Do you feel like accessing the present moment, being mindful, has something to do also with using your hands and doing something with your hands?
Yeah.
Like for example, if I would do gardening, I have to focus on what I'm doing. If I clean the dishes, or if I paint, I cannot be just in my mind. I have to focus on what I do. How do you experience that?
I completely agree. However, I think a lot of the times I'm cleaning the dishes, I'm thinking about my problems at work.
If you do something repetitive,
yes,
most likely.
So I think that, this is my understanding of this, that mindfulness for me, it is a practice. It is something that has some discipline. In the same way, learning to make tables by a carpenter, it takes time. At the beginning, the table doesn't look straight, but over time they become more skilled. And then mindfulness, you sit and you watch the breath. You create the most simple space you can. You turn off the phone, you remove distractions, you pay attention to your breath. This is a practice because we want that state to become more of a default state, so that it translates. We can transition from the meditation cushion into washing the dishes, and we're more present washing the dishes. And I think that it is important to have mindfulness of everyday tasks. That is the intention, but there can be some effort required in order for that to be your reality.
Or something new. What I came across is that if you do something new to you, it becomes a mindful practice.
Yes.
This is why also when people travel to new cities or travel around the world, they have to be present. The mind cannot go on autopilot because they don't know, the mind doesn't know what is happening right now.
Yes.
And this is where I feel like people going on vacation, they feel relaxed. It's basically because they had a period where they have been mindful and more connected to the present moment. Whereas if they would stay at home or repeatedly go to the same place and do the same thing, it would be most likely less relaxing and beneficial.
Yeah, I would agree with that to some extent. But I think that people who doing something new, like when you're learning to drive a car, at the beginning, you're having to move the stick, and you have to be very mindful. The problem is it very quickly becomes automatic. We see how the processing style in the brain moves into the default mode network when people are driving the car after 1 week of learning. They can drive and worry. So I think there is a million good reasons to go on a holiday and to take a break. And there is that sense of seeing something new. But the trick, Abdullah, is that we can have that same experience in every moment of our lives. Like here we are, we're not the same person we were this morning. This office is not the same as it was yesterday because you're not the same as you were yesterday. And there's also these images from the mindfulness tradition. For example, you can never step in the same river twice. And that's true because people change. Change is the only thing. Shift happens. And I think that is true. And you're not the same person you were yesterday. Our clients are not the same person they were when they arrived. And that's such a valuable thing for them to remember, that they change, that they can change, and that this space that we are in can be perceived completely differently as a result of our therapy work and as a result of our inner transformation. So something that looks the same, in many ways is the same, but our relationship with it has completely shifted and transformed. That's the beauty of working with our clients.
No, certainly. I mean, mindfulness, being mindful is like a muscle. You have also to train it.
Yeah.
You cannot just switch it on and here it is. It's years of training, most likely, and doing something. But also, what comes to my mind is we always say the autopilot, the mind is on autopilot, but this is not just bad, because we would be overwhelmed if we have to think about everything we do in our daily life. If we have to think about now, how do I need to brush my teeth, or how do I need to walk or walk up the stairs? So we learn from small upwards.
But the difficulty is, I completely agree. The difficulty is that style of processing is completely over-habituated. We are amazing problem solvers, Abdul. Look, you set up this amazing studio. This is problem solving. We can build an iPhone.
I delegate.
Yes, exactly. And you can decide what tonight's dinner is. We can really we can do those things amazingly. But the problem is, and if you look at the research of Antonio Damasio and his work on somatic markers, he says the problem is we're stuck. It's like a pendulation. We have a pendulum that swings. It can swing between processing our experience in a thinking way, in a doing way, let's say, or processing it in a sensing way. Now, the problem is that we are very much stuck in the thinking way. So you get a problem. Let me explain, because I think this is useful. If you have a problem, if you have a problem at work today, when you go home, what are you going to do with that problem? You're going to spend the whole evening thinking about that problem. It's going to make you upset. You might not eat your dinner. You're going to fixate on it. Now, it's right that we do that because we're great problem solvers, but how likely is it that you'll just close your eyes and feel the sensations in your body and work with that problem, not in a cognitive way, but in a more direct, sensing, emotional. And I'll just say one last thing to that, which is Antonio Damasio's research, for example, shows that people who cannot connect to their body, who cannot feel their body, feel their stomach, feel their breathing, they find it difficult to choose food on a menu. That's what the reason. It's very simple things. They feel they have this lack of wisdom, this lack of this gut feeling that informs good decision making.
Yes,
and that is also a problem. And this is a problem we have with the clients: is that they can't make simple, good decisions because they're so disconnected from their bodies. So both of these processing styles are really important. The thinking and the emotional, getting in contact with our emotions. The problem is the pendulum gets stuck here. Yes. And people need to remember that they have this wisdom to drop into, to connect to.
Sometimes in my daily life, when it gets stressful, I try to access these problem-solving situations. But if I have to make, as an entrepreneur, too many decisions, too many problems at the same time happening, and I hear this often also from other entrepreneurs or some of our clients, that they get tired of decision-making itself. And there, I truly believe in meditation and breathwork to help to connect. In your practice, you mentioned trauma, eating disorders. What other type of conditions would you consider body-based, mindfulness-based psychotherapy is helpful?
Depression is a really good one. For example, one of the things that we see, one of the cognitive patterns that underpins depression is that, okay, we all have difficult thoughts. You have difficult thoughts. I have difficult thoughts. We notice how, we wake up in the morning, we're having a hard time, and we see that our mind is, we have familiar patterns of difficult thought. John Kabat-Zinn calls this the curriculum. Abdullah, you have your curriculum, I have mine.
Certainly.
And that's our challenge, is to work through the curriculum. But what happens with depression, for example, is that because the person has low mood, they feel low in themselves. They're more likely to believe those thoughts are true. So that's a characteristic of depression. So you and I may not suffer from depression, but we still have the difficult thoughts. But what you notice is that if you get tired, if you have too much stress at work, if you're not sleeping because your children keep waking up during the night, or there's a lot of stress going on with your parents or your family, and your mood starts to decrease, starts to lower, that's when you start to perceive those thoughts as being true, more true than before. And that's when you might end up in in an episode of depression. So I think mindfulness, it can help us. That's one case where mindfulness can be helpful, is to help people who suffer from depression understand this relationship between mood and their investment, or how much they believe their thoughts. And yeah, I think that with trauma, if we can have a well-tailored practice, we choose the right practice. Again, it could be yoga, or it could be a seated position. All of these conditions will benefit from this increase in the person's capacity for embodied self-awareness. It just has this, it's transformative and healing. People talk about the gut brain as being our second brain. But actually, if we look at the evolution of the gut, it's much older than the one up here.
Yeah.
This is the first brain. This is the wisdom that we can drop into. And this is the second brain. So we need to come into the wisdom of the body, and that will help us to make decisions as an entrepreneur. It'll help us to to work with our anxiety. It will help us to work with depression. It will help us to transform our trauma. But again, I think often it's not enough by itself, especially people with trauma. They need to have some therapy, some support. But maybe this would be a good moment for me to teach a mindfulness practice based upon what I've said. So this is a practice from Mindfulness-Based Cognitive Therapy. It's a practice called the 3-minute breathing space. Actually, it's no longer called that. It's called the 3-step breathing space, because the intention is it can be done in 1 minute. Okay, it doesn't have to be limited to a time. You can do it as a longer practice, or you can do it as a shorter practice. And this is a practice that we can call in a first aid practice, like in an emergency. And it's also, so the practice I'm about to teach it's done as when somebody's having a moment of crisis. But it's also done in a way that you described earlier, actually, which is you set a timer, or there's bells, at random intervals during the day. You have a bell that rings, and the invitation is to do this practice so that you can start to cultivate the capacity to be mindful throughout your day. And you can be you can work, you can develop these skills, as again, John Kabat-Zinn, who I'm quoting a lot today, he says, we don't want to be tying the parachute when the airplane has burst into flames. We want to integrate these skills into our day so that whenever we're having a moment of difficulty, we can naturally call upon them. So let's do the 3-step breathing space together.
So you do want me to do it with you?
So yeah, we do it together. And what you can do is we uncross our legs. I'll uncross my legs too. And we just find a good posture, just a shift of position. And let's close our eyes. If you're okay to close your eyes,
Certainly.
we can close our eyes. So step 1 is acknowledging what is here. So just notice what is present, what the inner weather is. Is it stormy? Is it calm? Is there pain in your body? What emotions may be present? Notice, is your mind busy or quiet? Notice maybe you're thinking about the next question. You can see what's there. You can feel the contact of your body with the floor, with the chair. So just acknowledging what is here, what is present. Maybe things that are easy, it may be difficult experiences. Step 2, gathering your attention around the breath. So let's feel the breath in the body. Maybe we can focus on the belly, the core of the body, and just feeling the movement of your belly and abdomen as you breathe. Feel how the abdominal wall moves towards the spine when you exhale. Moves away from the spine when you inhale. So not thinking about the breath, but feeling the sensations of breathing in your body. Notice if you get distracted, you start to think about something. And when you notice that, return your attention to the sensations of breathing in the belly and abdomen. And now step 3, expanding the breath into the whole body. You can be aware of your breath and aware of your emotions. Perhaps there's difficult emotions present, and you can have a sense of your breath, and at the same time, a sense of your emotions. Maybe you have physical pain or discomfort in the body, and you can feel the breath and feel the discomfort. Or maybe you have difficult thoughts, and you can just notice the arising and passing of your thoughts, and at the same time, feel the sensations of breathing. A sense of breathing into your whole body. And when you're ready, in your own time, you can slowly open your eyes and bring the practice to a close. So very simple practice. This is the
Thank you.
3-step breathing space. And the first part is just acknowledging what is here. Being present, remembering,
Yeah.
shifting the attention to the breath, because that's developing a skill, like a carpenter, like an artisan, developing a skill that you can shift your attention somewhere else. And the third is working wisely, being with your difficulty and being with a sense of presence. And these are very useful skills. And you can do that sitting at the bus stop. You can do it as a longer practice. You can do that as a 30-minute practice at night. And it's just a way of working wisely with our difficulty, cultivating wisdom and presence.
Yeah. Thank you for guiding me.
Thank you.
I felt like it's kind of cleaning the mind. I would compare it like if I would go and wash my hands or go take a shower, but it's like more cleaning the mind.
Yeah.
And if we do this couple times a day,
Yeah.
it's connecting.
Yeah. Yeah.
Yeah. Thank you.
It's a very beautiful, simple practice. And honestly, it was a practice that they call it the spine of MBCT. They say it's the most important practice, but it's a Zen practice. This is how if I'm teaching a meditation, a more Zen style practice, it's the same one. So this is just condensed into 3 minutes. It's just a simple, beautiful little practice. And yeah, I agree. If you can set timers and you do this a few times a day, you do it when you're not having difficulty, you do it when you're having difficulty. Suddenly we're finding a capacity for adaptivity, for wisdom, for ways of working that we may not have noticed before, and some unconscious processing. And yeah, things can change and shift.
And not to be dragged in emotionally into little micro things which are happening throughout the day, but really take this distance and have more the pilot view of what's going on.
Yeah.
Mindfulness certainly helps to disconnect the mind and disconnect from current problems, thought patterns, and so on.
I would use the word integrate rather than disconnect. It helps to integrate the mind.
Yes.
Yeah. And integrate with the problems.
Synchronize, integrate.
Yeah.
What I think about is also, it's kind of a mini simplifying your life.
Oh, for sure.
On a micro scale, you could minify or simplify your life, recognizing what is causing this stressful life.
Yeah.
So anytime something happens, so think about what can you change, how can you simplify it. And I often see this with clients. They have type of our clients. They have houses around the world. They have things and stuff, and they travel a lot. And what happens often is that they become slaves of what they have to do and perform just to keep things up. And then I find and see people who have less to be more calm, to more the slow living type of people in some part of the world, cultures of the world where there is not much around. They feel more cleaner and calmer because they don't have these responsibilities. And I think,
isn't that the irony of our clients in some ways? Like our clients are the people who can, they're some of the wealthiest people in the world. They could construct their life in the most amazing way. They could spend the rest of their life on a yacht, traveling and enjoying every moment of their existence. And I think the irony is sometimes that they feel like they don't have these choices or these options. And sometimes that's just, it can be really helpful to say, actually, you can simplify, you can pay attention, you can take a breath and shift things around. You don't need the 6 houses. There's a lot that can be done just to make their life more simple and more meaningful, Abdullah. This is the point also. It's more meaningful.
If it's just wealth to manage, I would agree. If there is fame included, it's a little bit more difficult unless you withdraw yourself from the public presence. There are certainly difficulties there.
But if mindfulness teaches us something, what it can also teach us is that we don't have to be so invested in how we're perceived, in how, so even for a celebrity, for example, we can help through mindful awareness, we can help the celebrity not feel that they have to believe everything that's written about them, that they have to react. This is all about reactivity. And reactivity is a double-edged sword. It's about trying to present ourselves to the world in a certain way. It's also about not liking how the world presents us to the world. So it's a double-edged sword, and we have to support the client in just allowing and accepting what is. That's the first stage of that 3-step breathing space, just being present to what is there. So even with a celebrity, the simplification can be that I can accept things as they are. I don't need to control everything. And that is a huge simplification for someone.
I agree. If someone is in a state of who's able to access inner wisdom, the self-esteem has been developed properly. But if I think about, let's say, young adults where their brain has not been developed properly, they become famous, they jump into some substances or other abusive environment where people want to profit from them and their fame. They haven't developed their self-esteem at that stage, and this is where we see often also public figures dying from overdose and having other mental health problems and disorders. But many can get out of it, as you say.
And they do the work. They come, like, I think that what we offer is amazing because it's very personalized care. The rhythms are very slow. So I think, what I see from the balance is a lot of the care that we offer people is about a slower rhythm. It's not always fancy technology. It's not always the latest neuroimaging. It's about giving the client space to be themselves, to experience boredom, to experience to remember that they have emotions, to remember that they can be a different way. And even for young people, when I reflect on myself, I was 18 when I found these practices. I was in a difficult space, and it helped me. And it helped me very quickly because I started to get some insight and perspective. And my nervous system started to switch to a slower rhythm. And I think that with young people, it's difficult. I agree. The brain isn't developed. And like we see this mental health crisis that came up when the iPhone put the front-facing camera on the iPhone, 2007, I think that was. And we see, rates of eating disorders soaring. We see all sorts of issues that come, and they're very difficult to manage. But we can shift, we can support clients, and we can transform how they experience the world. Even celebrities, even people who, like some of the people that we've worked with, and you would almost say it was hopeless. And yet we see such a huge transformation just from slowing down, just from doing talking therapy, from reconnecting to themselves, remembering who they are.
And what they want.
And what they want, and it works. This stuff works.
Yes, this is why we exist, and this is why we are doing this. In your career, you also mentioned you went into further trainings to complete the full picture of work you can implement to the clinical sessions you have with your clients. You mentioned somatic experiencing. Can you elaborate on that? How is it helping you, and where do you see the benefits implementing somatic work with your psychotherapeutic work?
I know that, especially working sometimes with other therapists, they don't always understand what somatic experiencing is. Like, what is this? I think the clue is in the name. This is the soma, this is the body, and it's about experiencing the body. So it's just experiencing what is here. And Peter Levine tells this wonderful, he reinterprets, Peter Levine is the person who created somatic experiencing. And he has this reinterpretation of the Medusa myth, which I think is very helpful for understanding what somatic experiencing is. So we all know the story of Medusa. All these warriors went out to slay Medusa, and they were unsuccessful. Perseus was a little bit wiser. He visited Athena, the goddess of wisdom, and she said, don't look in at her eyes. You'll turn to stone. Look at her reflection and you'll get close enough to cut off her head. So first of all, we have this image of Medusa. Her head is crowned with snakes, which is a symbol of transformation. And then we have the understanding that trauma, if we look at it, if we look in trauma's eye, we turn to stone, we freeze. And we understand this about the nervous system also from Stephen Porges's work. We understand this state of parasympathetic freeze that comes. It's something that happens as a result of trauma. But if we can look at the mind's reflection, which is the sensations in the body, well, some of these thoughts and images that we have that are overwhelming, that freeze us, when we bring our awareness to the body, there's more movement, there's more adaptivity. And we can start to become friendly with the trauma, with the experience, and we can start to transform it in a sort of roundabout way. You know, we by connecting, by paying attention to this somatic experience, the mind's reflection, the sensations in the body, we can start to transform the trauma. And in somatic experiencing, there's some really useful skills. For example, pendulation, which is, let's say we're in a therapy session and the person is talking about their trauma, and they feel like they've an overwhelming intensity in their stomach, in their belly. Then the client will tell me that. And then I will say, okay, so is there anywhere in your body that feels good? And then the client might say, well, my breathing feels good. It feels easy. And I'll say to the client, okay, let's take a minute and just feel the sensations of breathing. Not think about breathing, but feel the rhythm, the cadence, the depth of the breath. And we'll do that for a moment. And then we'll bring the awareness back to the difficult sensations in the belly and the stomach. And we'll stay with that for a moment. And then we'll bring the awareness back to what's good about the breathing. And it's this sort of process of metabolizing those metabolizing or processing those difficult somatic experiences. Yeah. And because the body and mind is one, whatever we do in the body, whatever transformation we get through our emotional body, our sensory body, will translate into changes in perception. And that's the beauty of somatic experiencing. But honestly, I see all of my work as, I don't tend to label it somatic experiences. Sometimes on the schedule it says somatic experiencing or mindfulness-based therapy. I only work in one way. Yeah. And I work at reconnecting the client to their body and to transform the relationship between the body and mind. And if I might use some specific somatic experiencing skills like pendulation or titration or these types of things. But I think it's just about reconnecting to the wisdom of the body. And that's what somatic experiencing, again, is about.
So I understand your work is always a combination from the body up and using psychotherapy work. Combining the different methods you have gathered throughout the years and worked with your clients, what type of changes have you seen happening or moving in your clients?
Yeah, I've seen remarkable changes in the clients, and I must say I'm part of a team, especially in the balance, so I can't take all the credit. I have to share the credit with all the therapists, and we've seen remarkable changes. One of the things that I will say to the client at the beginning of the session work, and it's something that I've shared already in here, that for me, the point of the work isn't just to fix things, or isn't to stop using drugs, or isn't to isn't to make these changes necessarily. The point of the work is to live a life that is meaningful and joyful. Especially when we're talking about trauma, we one of the characteristics that's synonymous with people who've experienced trauma is it's a sentence that goes like this. Life used to be fun, and it's not fun anymore. I used to enjoy just being in my body and doing simple things, and now I don't have any joy in my life. So when I start working with the client, I really orientate them towards this, that they can recover their experience of joy, well-being, and happiness. That's the benchmark for my work. And then what we see as they start to recover that meaning and joy in their life, there's a natural letting go of the need to use cocaine or the need to use alcohol. They develop a natural resiliency. I will say to the clients also that, every day that they don't use is a bigger distance between today and the last time they used. So that is developing resilience in the client. That's developing capacity. It's cultivating their capacity. I see clients completely transform. I see clients when you think that it's hopeless, that they've got nothing meaningful in their lives, they've got nothing joyful, that even in a space of 6 weeks, and granted, I can be working quite intensely with the clients, maybe 3 times a week, but we see how meaning comes back into their life. And even in clients where they have experienced debilitating trauma that you would expect to finish most people, you see how they can recover from it, and it can be something that is no longer, when they think about the trauma, they're not reliving it. They're simply remembering something from the past. And this is a key piece of my work, is to talk about the trauma, the difficult memories, the difficult experiences. And you see in the beginning that when the client presents this kind of stuff, these experiences, they relive it. Their body and their nervous system is responding in a way as if it is happening in real time. And slowly, we go through this process of becoming more friendly with it and then letting it go. And what we can see is that the client starts to, the patterns that are maintaining the reliving of the trauma, they begin to atrophy. And over time, even over weeks, months, and years, these terrible experiences can become just a memory of something that happened in the past. And as time goes by, that memory is recalled less and less, and it's not having the same impact upon the client and their life. And that's what I see with my clients. I see, and I think that the many therapies that we're offering, including body work, equine therapy. I love that we have music and art therapy and ceramics, because these are things that we used to love doing as children. This is all about joy. Another thing that I love to see in my clients is that creativity comes back. In this story of the Medusa myth told by Peter Levine, after Medusa's head is removed, out of her body comes Pegasus, the winged horse, and Creosaur, a warrior with a golden sword. These symbolize spontaneity. If you've ever been on a horse and it gets spooked, they're pretty spontaneous animals. And life can be spontaneous again, because what happens through trauma or through difficult experiences, life becomes very patterned. We think that we cannot shake off these patterns. And we recover spontaneity. And then we recover clarity. We're able to have a clear life purpose. We're able to do the things that we want, not because we think we should do them, or these are things that our parents have told us we should do. This is what Abdullah should do. He should become a doctor, or he should study law, or whatever your parents were telling, like the things that you have been very deeply ingrained that you should do, but didn't resonate with your soul. Clarity can emerge. And this is why I love art therapy, because it's about just being and expressing oneself and nurturing that piece of ourselves, like a little seedling that can grow into this oak tree of living our life purpose. And I think that that's what hopefully we see with the clients. It doesn't happen overnight. It takes work. And when a note about the mindfulness of breathing practice, I remember there was a quote from Chogyam Trungpa, a very famous Tibetan meditation teacher, who said, he talked about the precision and beauty of the breath. And if we can find that precision and beauty of the breath in simply breathing, that can expand to all parts of our lives. That can expand to how we make our breakfast, how we relate to our children, how we relate to our loved ones. And this is what we're trying to recover with the client, or trying to remember, because it's innate. It's innate in us. And we can remember that, and we can support the client in remembering it for themselves.
Yeah, beautifully said. That's the goal, to disconnect from where you feel you are down, and explore different things with the different elements you mentioned in therapy and treatment, and hopefully find something which gives you this motivation to see the glass half full again, and going forward. I know you do a great job. You do great work, results. The work you do resonates a lot with the clients. I would like to share with you a quote from one of the clients about your work.
Okay, I'm super curious.
With him. David was a fantastic guide in my journey at the balance. His example and safe presence allowed me to connect with my masculinity in a healthy way for the first time in my life.
Yeah, that's lovely. And, I think that it's not easy being a man sometimes. And, some of the clients, they come from very defined roles of, what a man should be. And I can imagine which clients may have said this. There's several. And it's lovely. It's lovely to work with people, work with men, and have them connect to their body, to their emotions, to their senses, and to understand that this is the resource that we have to carry us through life, and that there's wisdom in the body. And if we can just take a pause, take a breath, listen to our experience, it will help to guide us. And we do lots of other work. We do lots of self-reflection and self-help and all of these different things. But we can have this operating system, this platform of just being in our bodies. And it's lovely to hear a client's reflection.
Now, this has been certainly a man. Do you feel there are differences between men and women connecting to their body and accessing it, or how do you see this?
Well, I think what I experience, Abdullah, and maybe you can relate to this, is that we often don't have the skills, us guys. We've been told, I seen this advert many years ago in the Sunday Times newspaper. And it was an advert. It was a bunch of construction workers building a steel reinforced wall. And the advert said, some men get in touch with their feelings. Real men build steel reinforced walls. Buy Black & Decker. That was the advert. And I remember thinking, okay, there's the problem. There's the Achilles heel is there, because people think that that's what real men do. But that becomes the point of vulnerability. And I see that with so many men. I seen it from myself. I came from a working class family, my father was a fisherman. People did not get in touch with their feelings. People built steel reinforced walls. But that becomes the vulnerability. And you can maybe relate to that. I know many men who relate to that. Women, my experience is they have more opportunity to share. They talk about their bodies. They connect with each other. They have a sisterhood, which we often lack. Now, I'm not saying that's the same for everyone, but I can speak to the men a little bit because I am a man, that this is something that I see. And I think that we can, where there is that mindset and that way of relating, there is a vulnerability.
Yeah.
And I think by helping men connect to their emotions, they suddenly, and their body, their sensations, they don't explode. They become stronger. They become more able to have a meaningful relationship. And again, this is what it's all about. It's about having a meaningful life.
Exactly. We know from statistics that there are differences. There are more women reaching out for help than men, but there are higher suicidal rates in men than in women. And I really hope that men with this mental health crisis we are in worldwide become more open to reach out and get help wherever they need it.
Yeah.
So, talking about all problems and conditions and work you do, how do you, David, manage to stay in balance in your own daily life? Are there specific activities, special practices beside now meditation? Certainly, I understand.
Yeah.
What do you do?
I try to have a slower life as much as I can, and I have a tendency to work way too much, and I come from a culture where there's a lot of alcohol, smoking, overeating, all of these things, and I can certainly participate in that. So I need to be careful. I need to take care. And so what I do, I try to exercise. I feel it's important. I swim most days. I do breath work. I'm a lifelong asthmatic, and breath work has helped me to completely transform my asthma. I follow mostly a sort of paleo diet. We're getting into terms here, but I try to not eat so much carbs. I eat a paleo diet. Yeah. What else do I do? I have friends. I go to concerts. I try to have a social life, community. I surf as much as I can. I kite surf and windsurf. So I think all of those activities are really important for me. But certainly, eating well, meditation, breath work, and swimming, those are my daily practices to keep me sane.
And what would you, if you can now talk to everyone in the world, what would you suggest to them or tell them as a recommendation, what they can do, should do?
Yeah, well, I think maybe just take a breath, slow down, feel your children's hands in your hands, taste the food that you're eating. Find ways to just take a breath and to listen to themselves and to listen, just to come into the moment and cultivate that capacity, because it's something that can be cultivated. Something we've forgotten. It's something that can be remembered. And it's very simple. And we're seeing, as you said, a mental health crisis. We're seeing the whole world trending towards this fight, flight, sympathetic arousal. We're drinking a bucket of coffee to get us going. We're driving in terrible traffic. We're stuck in, underpaid jobs. We're having troubles. And I think that just take a breath, reconnect to oneself, listen to your inner wisdom, and let it guide you. And I think that's super valuable. Yeah.
Thank you so much for your wisdom and your great work you do with all the clients. I look forward to see much more feedback of the ones we have had. Thank you so much for being here today. It was a pleasure for me to have this conversation with you, David. Thank you.
Thank you, Abdul. It's a pleasure. It's a pleasure to work at the balance. It's a pleasure to work with the clients at the balance. And yeah, we keep going. Thank you.